All right, adjunct procedure to buccal fat pad removal, sculpting to enhance or sharpen, sculpt, snatch, all those things to the face. Kind of a classic one I think everybody knows. You have the masseter muscle. It's actually the strongest muscle in the body per muscular unit, per volume. Think about an alligator, how strong you can bite down versus how strong you can flex your arm. Your masseter muscle is stronger. So you put a neurotoxin of some sort into that masseter muscle. I also think people don't understand why we do that. So the masseter muscle is a strong muscle, as I mentioned, so it's bulky. So it creates roundness. It's full of blood, it's beefy, it's red. If you operate on it, when somebody breaks their mandible, if you operate on it, it gets really swollen. It's round. It does not snatch you. So when you put a neurotoxin in the masseter muscle, it allows it to kind of become flaccid, and if you do it enough times over a long enough period, it becomes atrophied, so it's soft. Then what do you see? Then you see the angle of the jaw. The jawbone is made of calcium hydroxyapatite, made of a firm structure. When you get rid of the masseter muscle, you see a sharp angle of the jaw, and that's hot. Hot is hot. That's what people like. So that's why they do that. The downfall is you have to do it, recurrent and frequently, but we're happy to see it. So that's that. The other option, as I alluded to earlier, would be to augment the cheek. If you augment the cheek, you create a shadow below it. If you augment the jawline, you create a shadow below it. So that's with fillers. There are implants for this. Typically, again, I'm only doing those for reconstructive cases. People have these weird congenital anomalies or fractures, but it is an option. We have newer devices that have bipolar radio frequency. It sits on your face like this and slowly delivers bipolar radio frequency to narrow the buccal fat pad. Also, focal skin tightening. So people talk about skin tightening in the face. If you tighten the whole face, that's good. It'll improve the skin. It'll look nice. But if you can focally tighten here, you can get the illusion or the kind of some of the effect of what a buccal fat can bring. And another thing I beg patients to do, I've started giving them one included in buccal fat many times, where if you put a little bit of filler in the chin, it really can make a big difference, because as you lengthen the chin, you're focally tightening that skin in the superficial jawline area.